All right.
Hello.
Hi, everyone. I'm Chloe. So today I'm going to be presenting my Master of Science in Nursing thesis. So this project is still in the still in like the ongoing phase of research and data collection. So I'm going to be presenting my protocol to you all. So the topic is on family involvement in the acute care of patients with chronic illnesses while they're hospitalized. So I just want to give you a little bit of background as to what made me want to learn more about this and do my research on this. So I am a pediatric nurse. So in this position, I see a lot of families be involved within the care of their children when they're hospitalized, whether that be patients who have chronic illnesses or patients who are in with only acute illnesses. I see it very, very frequently. We encourage families to stay the whole time throughout the stay, to be hands-on involved, have do their own care, kind of act as much like they were at home as possible, so things can just smoothly return to how they would when they get discharged. But with this, I had a lot of questions about what this looked like for other populations. So that's kind of what brought up this topic. I was really interested in learning about not just the pediatric population, but also other populations as well, and how families are involved and how they're kind of encouraged to be involved. So I decided to complete my thesis on this topic, and it is a scoping review to gain a better understanding of those strategies and gain like a essentially form kind of like a better list or better comprehensive um, like understanding of all the strategies and frameworks that have been created. Um, what we'll go over today is just an introduction and background on the study, as well as we'll talk about some of the main concepts, my research questions, and then also the research methods that are being used. So just a little bit of background. Family-centered care in healthcare is extremely important. We're seeing it more and more every day. As a newer nurse, when I started school, it was just kind of starting to be more taught that family-centered care is the way to go for nursing now. Um, and that we should be encouraging families to be involved in the care, and we want to make sure that they have a say as well as the patient, and together with the patient, that they have a say in the care that the patient is receiving. So this is also important with understanding the expertise that the family can bring to patient care. It's important to know as healthcare practitioners that we don't know this patient as well as their family does. This family is so important to the patient, and they can vouch for them that they are that they take care of themselves this way, or that they help them to take care of themselves this way. We want to make sure that we have a good relationship with both the family and the patient, so that we can gain the most understanding of the patient and be able to care for them the best way that we can, and continue to encourage these families to be involved as much as they would be outside of the hospital within the hospital. So it's also very important to encourage family involvement with patients who have chronic illnesses, just like it is with any other patient, but chronic illnesses can take a big toll on patients and families' lives. And a lot of times these families and the patients have kind of like a strategy of their own whenever they're in their own environment in that home. So we want to make sure that we're allowing these families and patients to continue that like motion of what they do at home while they're in hospital, because it makes it a lot easier for when they transition back to home or wherever they transition to make sure that these people are very comfortable with leaving the hospital and are able to kind of care for themselves or care for themselves with the support of their family. So family participation in care, it comes in three different kind of sections. We have involvement in decision making, partnership with practitioner, and direct care. So these can be present within the hospital and also out of the hospital in their own environment. So the involvement in decision making talks about making sure that families are kind of kept up to date and as much as the patient would like them to be, and that they are able to kind of help both the practitioner and the patient make decisions moving forward about the care of the patient. And then we talk about partnership with the practitioner. So a lot of times this is not just the family and the practitioner, but also the family, patient, and the practitioner. So just making sure that there's like a good line of communication between all three parties, and that all of the information is kind of being shared within the group, and that the best care can be given moving forward. And then finally is direct care. So that's kind of like the hands-on care if the patient needs assistance with their activities of daily living, how the family kind of helps with that. Are they helping them to walk? Are they helping them to get bathed every day? And that can really transition over to the hospital as well. If this is the care that the family is getting or the family is giving at home, it is good to kind of continue that care while they're in the hospital so it's not a huge change in their everyday life. A change to the hospital can be very scary for both patients and families, so we want to make sure that we're giving them as much support as possible to encourage them to continue to do their everyday things, if that includes direct care with the patient. And then finally, there's definitely a knowledge gap on the strategies and frameworks that are used to involve families in care. So there is definitely some out there, but there isn't a good comprehensive understanding of what all of those are. So the goal of this study is to gather as many strategies and frameworks that we can from these studies, and identify how they work and how they're used, and how they can help to improve family involvement in care. So now we'll go into my main concepts. So I have three main concepts, the first one being chronic illness. So for this study, chronic illness will be defined as an illness that lasts at least 6 months. It's long lasting. It is usually results in a lot of visits with physicians or medical appointments, and it's usually not curable. This can be a physical illness, but we'll also be looking at mental health illnesses, as we know that can definitely be a chronic illness as well. So some of the examples in this picture are heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, or any kind of dementia, diabetes, or chronic kidney disease. And like I said, we will be including any kind of mental health illness that can be long-lasting and is defined as something that is not curable, but can be kind of treated. And then the next concept is family. So in this picture, you'll see it's a very big family. One thing with the definition of family is everybody's going to define it differently. With this study, we want to try to make it as broad as possible because we want to be able to include any type of family that the patient kind of sees fit. So if a study doesn't include family to be like blood relatives or even a relative at all, then that's okay. Family can be a neighbor, it can be a friend, it can be a blood relative, it could be a mother-in-law, it could be a daughter-in-law, it could be a son-in-law. Family is very, very broad, and we want to make sure that we're encompassing everybody's version of family to make sure that we're getting a very good idea of the involvement that can be present within the family. And then the final main concept is family involvement. So we want to make sure that we are only looking at studies that include family involvement within the hospital. It doesn't necessarily have to be that the family is involved outside of the hospital. We are seeing that quite frequently, but it can be just that the family is involved in the care of the patient while hospitalized, such as decision making, and helping to provide information to the healthcare practitioners. And then we'll go into my research question. So the main topic of this research is family involvement during a patient with chronic illness's acute hospital stay. So we're looking at patients who are hospitalized with an acute illness, but they also have an underlying chronic illness. So this could be somebody who goes into the hospital and maybe broke their hip, but they also have like a history of asthma. That could be included, or it could be somebody who has diabetes and they're in diabetic ketoacidosis and they're being admitted to the hospital for that. That is an acute exacerbation of the chronic illness, but they still have that chronic illness, so that could be included as well. And then the main question that we're looking at is what strategies or frameworks have been implemented to guide family involvement in the care of individuals with chronic illnesses during an acute inpatient hospital admission. So as I stated, we're looking at any kind of acute illness, but they have to be admitted for that acute illness. It could be an exacerbation of their chronic illness, or it could be something completely unrelated. We're also only looking at studies that talk on the strategies or frameworks that have been used to kind of help guide those families to be involved. And then I have 3 sub-questions that we'll be looking at. So these won't be the main reason that we include a study, but things that we're going to be looking at once we get to the data extraction phase. So we're going to be looking at how does the pre-hospital living situation, so if the families or if the patient's living in like long-term care, if they're living in a community care setting, or if they're in a family home. So how does this situation of a patient who has a chronic illness influence the strategies or frameworks that are implemented to guide family involvement in the care during an acute hospital admission? Then the second question is how do the demographics of a patient, so that could be what kind of chronic illness they have, the age, their gender, so what kind of how do the demographics of a patient with chronic illnesses influence the strategies or frameworks implemented to guide family involvement in care during an acute hospital admission? And then the final question is what tools are used to measure family involvement in care during acute hospital admissions of individuals with chronic illnesses? So for this question, we're kind of looking at how are they actually measuring how involved the family is, or how are they noting what kind of care the family is providing to the patient? Next, we'll go into my research methods. So as I stated, this is a scoping review. So this will be done in collaboration with, or not collaboration, but following the JBI scoping review methodology. So for the inclusion criteria, it's going to be looking at, as I stated, chronic illnesses. So the patients have to have a chronic illness, whether it's underlying or the reason that they're admitted. They will also be looking at family members and caregivers. So there has to be in the study a family member that is involved, not just present within the in the hospital, but actually involved in the care of the patient. We're not going to be looking at any demographic limitations, so any person is able to be involved. If any person with a chronic illness is in the study, we will include that study. We're not going to limit it on age or gender or anything like that. We want to get a good idea of any strategies or frameworks that are used to help family members stay involved. And then, of course, one of the inclusion criteria is family involvement during hospitalization. So we want to make sure that they're actually involved with the patient while they're hospitalized. It could be any of those 3 steps. It could be in collaboration or partnership with the physician or the nurses or whoever they're kind of looking at. It could be direct care with activities of daily living, or it could be decision making, or even just assisting the patient with decision making. And then the final inclusion criteria is that it's an acute care hospitalization or an acute illness. So we want to make sure that the patient is still in that acute illness for the studies to be included. It can't be somebody who was acutely ill but is now out of the phase and just awaiting for a way to get home or awaiting for a bed somewheres. And then for the exclusion criteria, we're going to exclude studies that only look at patient involvement only. So if it is a study that talks about, oh, we did this to make sure that the patient was involved in their own care, but doesn't discuss family involvement, that's going to be excluded. We're also going to exclude studies that talk about both patient and family involvement, and they can't be separated. So if it's talking about patient and family involvement as one, those will be excluded because we want to make sure that we're just getting the understanding of how do we get family members involved we don't want to mix it with the patient involvement as well. And then we'll be, like I said, excluding patients who are awaiting long-term care. Maybe they were acutely ill, they are now medically cleared, but they're just waiting for a bed. So those studies with those patients will be excluded. And then we're going to exclude any studies that don't report patients with chronic illnesses separately. So we're seeing this quite frequently in the data collection phase, where it's talking about both patients who have chronic illnesses and who do not, and they don't separate the data that was found. So those studies will be excluded because we want to focus on patients who have chronic illnesses, and we don't want to get some of those other patients wrapped in there because we're only looking at those who have chronic illnesses. We're going to exclude studies that take place in the emergency department because these patients have to actually be admitted to the hospital with an acute illness. We're going to exclude any community assisted living, long-term care, or rehabilitation facilities. With this being said, we are still going to look at patients who might be on a rehab unit, but are still in the acute phase of illness. So it could be a patient who had a stroke, and maybe they're still in the acute phase, but they've been moved over to the rehabilitation unit within the hospital, so that they can start working on those activities of daily living. Those kind of studies would be included, but if they're not still within the acute phase, and they report on that within the study, they will be excluded. So some of the key terms that we use to develop our search strategy is family involvement, acute care, hospital admission, and chronic illness. So we took those terms and kind of developed them a little bit further and created our search strategy within our 3 databases. So we used Medline, CINAHL, and Embase. With this, it resulted in 2,665 studies. So we're still in the, we just finished the title and abstract screening phase of this, but we are also going to be looking at gray literature as well. So we'll be looking at different types of papers and different policies and procedures that have been published. We'll be doing this through some Canadian databases as well as through Google searches. And then we go over to the screening process. So we are using Covidence to screen through these studies that have generated. So we're using 2 independent screeners to screen each study that's in the title and abstract phase, and then also the full text phase as well. And we have approximately 350 studies after the title and abstract screening. So now we're moving on to the full text screening. So we'll go through all of those 350 studies to decide if they are relevant or not. And then when we get to the data extraction, we are going to be critically appraising each study that makes it to the data extraction phase. We're going to have 2 independent reviewers do this. And I know that this isn't necessarily needed within a scoping review, but I do think it's very important to understand like the validity of the study and how relevant it is to like our study, and also like just understand if some studies are weaker than others, just get a better understanding of what kind of research was completed on this topic and where we need to go from here. And then for the data extraction portion, we are independently extracting this data, and then we'll have a second reviewer independently verify it as well. So for the outcomes that we're looking at, the primary outcomes are going to be details about the family or the caregiver. So that will be the relationship that they have with the patient, how they kind of know each other. It'll be information hopefully about like their age and a little bit of information about the family, so we can get a better understanding of like how it looks and any sorry, what's the word I'm thinking of? Any kind of connections that might form or patterns that we see between who is caring for these patients. And then we're also going to be looking at what type of healthcare was provided. So kind of what are they for what procedures did they receive while they were admitted to the hospital. We'll also be looking at the type of family contribution. So were they actually involved in direct care, such as helping the patients with activities of daily living, patient with, were they only doing the decision making without the patients, that kind of information. We'll also be looking at the study methods that were used. And then finally, we'll be looking at the frameworks and strategies and trying to determine any patterns between them. We won't necessarily only be looking at developed frameworks or strategies. It could be something as simple as, oh, we decided to increase our hours of visitation, family visitation, and we saw this increase in family involvement. It could be things like that. It doesn't necessarily have to be a framework that has been developed within like a study. It could be something as simple as just changing the policies. And then for secondary outcomes, we'll be looking at details about geographical location. We'll also be looking at some of the demographics of the patients, as well as the demographics of some of the family. We're going to be looking at the barriers and facilitators. So any barriers that families found were present and didn't allow them to actually be involved in the care of the patient. We'll also be looking at the healthcare provider. So who was the main person that encouraged the family involvement? And then finally, we're going to be looking at study measurement tools. So this will help us understand how are these studies actually being able to measure the amount of family involvement, and also how are they able to measure the strategies that are used within these settings. Yeah, and that is all. It's pretty short, but I'll stop sharing here. But yeah, that is my thesis protocol at this phase. Like I said, we're still in the data collection phase, so we're getting there. But yeah, any questions?
Margot?
Thanks. That's wonderful, Chloe. Thank you for sharing today. You really have a very thoughtful approach to your thesis. I was wondering, are you able to tap into like the family and youth council, or are they able to help, or kind of help validate sort of your process at the IWK?
I haven't looked into them very deeply yet. I was thinking once I kind of got through, I just submitted my manuscript for the protocol. So I'm hoping once I kind of get some feedback that I might be able to kind of reach out to them and see kind of where they're at and what they think of the process and if they have any kind of suggestions. But I haven't reached out to them at this point.
Yeah, that's a great strategy, just to have family represented in your research. So it's really, like I said, it's very thoughtful. And I wondered too, if you might be looking at the frameworks, or where there are maybe formal interventions developed, if they were developed by family,
Yeah.
or if family was involved, because it's kind of your whole thesis is the importance of including family. But
Yeah.
I just wondered if you thought about that piece of it too.
No, I definitely have. That's a big thing because I feel, especially as a nurse, working within the pediatric population, I feel like a lot of the policies to help encourage families to be involved are developed by like nurses, not necessarily families. Um, so I think that's very important because we might see a difference on if it's family created rather than like healthcare created or healthcare practitioner created. We might see a difference on families being involved in the rate at which those families kind of are involved within the patients. Yeah, I
Exactly. Yeah,
agree.
exactly. That's great. And a lot of people don't realize that chronic pain is actually a chronic illness now too. It's designated as a chronic illness. So if you were able to include that, it would really make a contribution to heightening awareness for people that chronic pain is considered within that chronic illness category.
Yeah. And it's interesting because a lot of when completing the search strategy, we kind of tried to avoid the term chronic illness because it can kind of take out some of those other illnesses that are now considered a chronic illness, but are not technically stated as a chronic illness. So we tried to avoid that term because we miss some of those important people who are experiencing these chronic illnesses but aren't necessarily identified as a chronic illness at this point.
That's interesting, isn't it? I know you can, as you're trying to define things and, create a collective piece of knowledge about it, it's kind of hard to navigate some of those questions, but it sounds like you're doing a great job thinking that
Thank
through.
you.
Thanks for sharing today. I
No
really
problem.
enjoyed your presentation.
Thank you.
There's a couple of things in the chat as well. So Madison Hickey said, great work, really interesting work, and it's helpful for my own work to see how yours is mapped out. And Lisa says, I would agree, I think we need to get beyond simply a parent feedback model where a patient representative may be involved at varying processes of the policy development.
Yeah, I definitely agree with that. I think the policy development needs to be more broad. I think right now it's either looked at as like family does it or healthcare practitioner does it, and I think it's more necessary to do like an interdisciplinary or like even have families involved kind of approach because you get so many different point of views and it's just better for the patient overall to do that, I think.
Any other questions, comments? If there's no other questions, we can call it a day or.
Great job, Chloe.
Yeah.
Thanks.
Well done. Thank you very much. Thank you everyone for coming.